Welcome to everyone in the room and also everyone who's following us from a distance, because we're live streaming this seminar as well. So it's quite exciting to be able to hold this seminar, to make use of the opportunity that Disa from Save the Children is in the country, and to be able to present some collaborative work that we've been doing over the last year and a half, and also to hear more about Save the Children's work on child-sensitive social protection in South Asia. So my name is Keetie Roelen, and I'm a research fellow at IDS and co-director of the Center for Social Protection, and working on issues of social protection and child-sensitive social protection, mostly in sub-Saharan Africa, but also South and Southeast Asia. Disa is a senior social protection advisor for Save the Children in South Asia, and working a lot in India, Bangladesh, Nepal, and the Philippines these days. So what we're going to do in the next hour and a half is we have two presentations. I will start with a presentation on our collaborative work, which is on child-sensitive social protection in Nepal. And then Disa is going to present on Save the Children's work in South Asia and their programs and approaches. Both presentations we are scheduled to last for about 20-25 minutes, leaving a good half hour for questions and comments. Now, for those who are following from via YouTube, if you have any questions or comments, you can provide them throughout, and there's a handle IDS UK that you can use, and the hashtag CSSP for child-sensitive social protection. Okay, so on that note, let me move over to the presentation on Nepal. Okay, so Save the Children and IDS started this work in November 2014 with the overall topic, how to improve social protection's response to collection, using interviews and field visits to understand how social protection is currently interacting with child poverty and vulnerability, and how it can be improved. And I'm also presenting this on behalf of our other colleague Helen, who is in Kathmandu and who also provided massive input into this project. So the overall question was, how can social protection better respond to child poverty and vulnerability in Nepal? And in this presentation, I'm not going to go over the child poverty and vulnerability assessment that we did, which is quite detailed but also quite lengthy. I will immediately start discussing the impact of social protection on child poverty and vulnerability in Nepal. And when I say impact of social protection, I mean a range of programs, government-implemented programs, and their impact on child poverty and vulnerability. So I'm not looking at a specific program or a specific policy. We try to get an overview of social protection in Nepal as a system and how that works for children. After having discussed the impact for some of these programs, I'm going to provide an overview of the main challenges in terms of impact. And then finally, the recommendations that we developed jointly, also during the workshop at the very end, with government representatives and international partners. Okay, now as a starting point, it's probably helpful to provide a definition of social protection as it's used in Nepal. So the reason we are looking at how child-sensitive social protection in Nepal is because there is already quite some work on social protection in the country. When we started this process, and also right now, the National Social Protection Framework is being drafted. It's still in draft, but it's an ongoing process. But it's quite far already in that there is a definition, a plan, costing, etc. But going back to the definition, we can see that it's quite a broad concept of social protection. When we look at it in more detail, it includes cash, it includes in kind, it focuses on the poor, but also on the vulnerable, There's a large focus on exclusion and including marginalized group because of the society as it is in Nepal. And so this offers a helpful starting point when we want to look at how the system helps children. But of course this is very broad. So quite helpfully in the framework, Nepal has used a life cycle approach to make social protection more operational, to provide a framework, a checklist, if you will, to see how well does our system come together, how well the different programs and policies come together to provide a coherent approach with respect to social protection, to provide assistance, to provide insurance and mechanisms that help people move out of poverty. Now the reasoning of the life cycle approach, it takes different stages in the life cycle and it looks at what kind of policies and programs are available for different stages in the life cycle. And although the font size is quite small in these boxes, you can see that it is indeed a very comprehensive listing. There are a lot of programs, but also in the framework, quite a lot is included as being social protection. So it includes cash transfers like senior citizens allowance and pension schemes, but also more in-kind services such as basic health care or microinsurance. So they take quite a comprehensive approach when we talk about social protection in Nepal. But of course the remit of our study was to look at what social protection does for children, or rather how child-sensitive social protection is. And for that, we also need a definition, so we can back up what we're actually looking at. And this is a definition that we use for child-sensitive social protection. And I think there are a few elements here to point out that are quite important as part of this definition. It's the aims of child-sensitive social protection, and I think the aim is twofold. So on the one hand, it's about maximizing the positive impact of social protection on children, when and where this is appropriate. But also it's about minimizing any potential unintended consequences or side effects as a result of implementing social protection. And while I think the first point is quite intuitive when we talk about child-sensitive social protection, I think the second point is not always considered or maybe ignored. Because the way in which programs are designed and implemented, they may have unintended side effects. If we talk about conditional cash transfers, what happens to caregivers and the care responsibilities that they have when they need to abide by certain conditions or meet certain requirements, for example. Or in public works, what happens to the care for children when they have to go to a public works site. So it's important to keep those in mind, and child-sensitive social protection is as much about improving the positives as reducing the negatives. And so it follows that when we look at interventions in terms of child-sensitive social protection, we don't only consider interventions that are targeted at children, like a child benefit or a child transfer. We also consider social protection programs for other target groups, like old age pensions or maybe livelihoods and public works programs that are targeted at people in working age. And we consider how these impact children. So it is from this definition of child-sensitive social protection and the definition of social protection in Nepal that we then looked at the scope for this study in terms of child-sensitive social protection in Nepal. And as you have seen in the slide on the life cycle approach in Nepal, there are many programs that we could look at. But we selected these different programs to consider in terms of their impact. And also here they are listed along the life cycle. So the first program is the AMA, or the Safe Mother program, which provides a monetary incentive for women to deliver in health clinics. 1,000 rupees for natural delivery and 5,000 if there are complications. Then there is a child grant, which is a basic child transfer. benefit for children and their families every month. Scholarships we also looked at, which is an annual lump sum amount provided to children in primary school, targeted at girls and Dalit children. We also considered the Cornelli employment program, which is a public works program in a particular region in the west of Nepal, aimed at those of working age. We considered the elderly by looking at old age allowance and also single women's allowance, which is a regular monthly cash transfer. And finally, we also considered disability allowances. And we did that on the basis of secondary information, largely. So what I'll be presenting in a moment is not based on a primary impact evaluation. It is bringing together the different types of evidence that we have, which includes our own interviews and field visits, but not any RCT type information. For the purpose of this presentation, I'm going to look at only a few of them. We're looking at the child grant and the scholarships to give you an idea of programs that are particularly targeted at children and how they do. I'll be talking about the Cornelli employment program, where we can also talk a little bit about that issue of unintended consequences on childcare of a program that's not targeted at children. And then the old age allowance and single women's allowance, and how a program targeted at older people can reach children. Now, the way in which we approach this consideration of impact is that we looked back at our child poverty and vulnerability assessment that we did as a first stage, a first step, and considered 6 different outcome areas that we felt are particularly pertinent for children in Nepal. These are poverty, which is mostly income poverty, nutrition, education, health, child labor, and child care. And for each of these, we used a traffic light system. So based on the information we have, we try to see, is there a positive impact of the program in this area, fairly positive, negative or no information available, or a maintenance of the status quo, which means there's either no impact or there are positive and negative effects that more or less seem to cancel each other out. Now again, I emphasize that we can not really attach any numbers to this. This is all relative, looking at the set of information that we have rather than specific benchmarks on percentage point increase or decrease, for example. But having this overview gives us a good indication of where we stand in Nepal. Alright then, let me start with the first one, for infants, which is the child grant. The child grant is a regular transfer that is targeted at children under 5 in one region of Nepal and children under 5 in Dalit communities in the rest of the country. So it's targeted at the very young, which links to the window of opportunity for infants, but also in most of the country targeted at the most marginalized group, children. We find that the program has modest impact, and there are a few reasons for this. Firstly, it's a very low amount, so it's 200 rupees per month per child, which is just a little bit more than £1. So it doesn't really do very much in terms of buying basic goods or helping children to access services. And in many of the interviews this was mentioned, that the amount is not substantial enough. Given this small amount, people have to prioritize what they spend on, of course. The studies that we looked at, we find that nutrition has the biggest impact. So it's mostly used for food and for dietary diversity, and that's across the range, that's where we find most impact. It does it has some positive impact in terms of reducing poverty and also improving health, particularly by improving access to health services. But we don't really know about the other areas. Now, other issues that play into the modest impact are irregular payments, which is an issue across all government-implemented social protection programs, having to do with budget and funding flows. Administrative delay which is linked to registration for this program, and that is particularly relevant for the child grant and young children. There's only, at this point, there's only one time in the year that you can register, which is by the 1st of December. If you have to register before the 1st of December to be able to get the transfer next year, August. So if you are born after the 1st of December, you will already have a delay of about 18 months because you can only be included in the next financial year. So it's a very, very rigid registration process that really defeats the purpose of having a grant that tries to target children in the first 1,000 days, which in essence is what this program tries to do, the first 1,000 days and then the first 5 years. Government and the Ministry of Local Development is currently working on trying to make that registration process more flexible to tackle this issue. And then two final issues is that people said, well, even if we have more money, there's low quality of services. So we can buy food, for example, but in terms of accessing health or education services, quality is very low. So the impact might still be very modest. And birth registration was an issue that went both ways. On the one hand, the fact that you need birth registration for your children to give them access to this program was seen as an excluding factor because children in the most marginalized and remote areas didn't have birth registration. On the other hand, it was also seen as a good incentive. Because you need birth registration, children will get registered because they will want to get onto this program. So results are mixed on that one. Now, during one of our field visits, we looked at how potentially the child grants could be, or the impact of the child grant could be improved. And this is a visit to one of Save the Children's project areas. So Disa will say more about this later on, I think, which is about sensitization work, in this case with the Dalit community, about how to spend the money and also how to get access to programs that people are entitled to. And these women were very clear that when we talked about the impact of a cash transfer and how it can make impact, they said the money is important and more money than what we receive now would be better, but really it's the sensitization and awareness and advice that we receive from the colleagues from Save the Children that helps us decide how we spend money, what kind of foods we buy, how we interact with our children and use the cash in a good way. And they also said it might be even more important than the cash because if the cash stops, which it does, because at the moment the transfer ends when a child turns 5 years old, they will still have that knowledge and awareness to be able to carry on spending any money they have beneficially for their children. And then another issue that was mentioned is that for many of these women, the information they received from the NGO about how to get access to the child grant was crucial in them even getting access to the transfer because most of these women were not part of the program before. So some sensitization elements added to a cash transfer could be really powerful in improving the impact. Right, moving on to the second program, scholarships. Now, although this is a very widely used program and a long-standing program, it actually has very limited impact. And that's mostly because it is a very low amount. It's 350 rupees, so a little bit more than two pounds per year per child that's provided to them at the beginning of the school year. It's targeted at girls and targeted at Dalit children, but it does very little when we look at the different areas of poverty and vulnerability and even education or stopping children to engage with child labor. People said it does not really address other barriers to education. It's not only about, even if the money was enough, it's not only about the money. There's more social barriers in terms of sending children to school. And some have also argued that the fact that it's targeted at Dalit children may actually reinforce stigmatization. And this is also linked to the issue of inclusion errors. In some of the communities, most children are poor. It's not just children of Dalit households that are suffering or cannot access schools. So some people said, at community level, the budget that's provided to schools to provide these scholarships is diluted across all the students in the school rather than just Dalit children. In a way that's to avoid stigmatization, but also to avoid tensions between children of different groups. But of course that dilutes the small amount that is already having a small impact. So overall, scholarships in terms of impact do little. All right, a program that we looked at in quite some more detail is Public Works, or this Cornelli employment program that I mentioned in the beginning, which is a public works program only taking place in the western mountains region of Nepal, one of the most disadvantaged regions, and targets people in working age and is supposed to provide them with 100 days of work per year. In terms of children, we found there's limited, modest impact. There is some reduction of poverty, some improvement in educational attainment or access to education. The biggest impact, again, we saw was on nutrition. People said it helped us most with buying food and having a more diverse diet. With respect to childcare, we found positives and also challenges that more or less equal each other out. Now, why was the impact not bigger than what we found? Again, a number of challenges in terms of implementation. First of all, the number of working days was much lower than 100, so the actual wage that people got was much lower. The wage rate in and of itself is quite low, so again, not really a substantial amount to make a big difference. Also here, there are inclusion and exclusion errors, which has to do a lot with political tensions at the local level. Who gets included in the program, who gets offered the work, because there's a quota, there's not enough work for everyone. And that also links to mismanagement of funds at the VDC, which is the Village Development Committee level, whereby some of the funds that were received to undertake these kinds of projects were simply given to a company to build infrastructure that they were supposed to build through this project. Now, many of these implementation challenges are known, and DFID has been working a lot on this program together with government, and they've tested new implementation and payment models to overcome some of these inclusion and exclusion areas and mismanagement. And also, they've tried to introduce childcare services to address that specific aspect that is relevant for children in terms of childcare. So a lot of the people working on this program are actually women, because men mostly migrate to India for work. And so they're in a position whereby they either have to take their children with them to the work site or leave them with others or leave them in care of siblings. So this is one of the childcare centers that was established as part of the project. And people said, yes, they can support care for children, but it's not unambiguously positive, because the centre does need to provide quality care, which was not necessarily the case. And also the caretaker needs to be paid equal wage. So in this case, the woman who is providing care to children was paid less than those who were working on public works. So the incentive for a caretaker is not very, very large. So in principle, it's a model that might work, but because of this issue around quality of care, few caretakers being willing to work, a new round of this program does not actually include guidelines on childcare centres, because the findings have been ambiguous. Now, another interesting thing that was mentioned with respect to childcare is that making sure that the program would reach that 100 days, or maybe include more days, could really make a difference with respect to family separation. They said if the program was to provide 100 days or more, our men would see it as a full job, and therefore they would not migrate to India. Our family would stay together, which would really benefit our children in terms of their care for various reasons. So there, that could be a really positive side effect, if you will, of a public works program for children. Okay, moving on quickly to the last program that I want to show you, which is Old Age Allowance and Single Women's Allowance. These are also regular cash transfers, like the child grant, monthly basis, provided to elderly and also older women and widows. It is quite generous in comparison to the others, particularly the Old Age Allowance. And so even though it's not targeted at children, we actually find that there's modest impact. And that's because a lot of elderly do spend money on different items for their grandchildren. This is from a study that Help Age International did. And that they see this as part of their cultural practice. You take care of your grandchildren, you provide them with what they need. And so, no target for children included, it can be quite a powerful program, and this is something that we've also seen in other contexts where children live with their grandparents who they have a lot of contact. Okay then, so what have we learned across these different programs? What are some of the main challenges? Well, some of the things that really inhibit the child sensitivity of social protection in Nepal is that there are many programs. We've looked at a few now, but you saw the cycle, there are lots. And they're not always very well connected or interlinked. And so some said we have a system, but it's a system. Because the interlinkages don't exist, some people fall between the cracks, and that's a problem that needs resolving. There is real lack of capacity, particularly at the village level. All these different programs, they might be implemented at national level by different ministries. When you come down to the village level, it's always a village development committee, and the secretary in particular that needs to do the on-the-ground implementation, and they become overwhelmed and overburdened. Budget constraints and limited coverage. We looked at these different programs and their effects on children, but when we look at them and the share of children in the country that they reach, it's actually a minority of children in the country that are reached by any type of social protection program. So in terms of scale, it's not that large. Inclusion and exclusion areas we saw are an issue. Irregular cash flows that lead to payments that are often delayed and also irregular, which makes it difficult for people to plan, to count on. And this inflexible registration process that is a real issue, particularly for children of young age in the child grant. Design and implementation-wise, we saw that the amounts are generally too small to make any impact, particularly the child grant and scholarship. There's also fairly limited awareness of programs, mostly of those that are targeted at children. The Old Age Allowance and the Single Women's Allowance, they have been in place for quite a long time, and people know how to access them, but less so for those targeted at children. At the moment, there is no integrated sensitization activity part of social protection transfers, and some said that this was a real problem in terms of knowledge and awareness of how to use transfers or other types of support for children. There are no grievance and complaints procedures, which is a real problem with respect to accountability. Also leading to limited awareness of programs. People have no mechanisms for complaining about inclusion or exclusion, or for raising any other concerns. And finally, in terms of child care and child protection, there's not a system whereby there's linkages to child protection or social work services. So in case someone comes across child protection violations in the implementation of the social protection programs, there's no mechanism or referral by which it can be taken up. So then finally, let me present you some of the recommendations that we put forward. The first one holds across the board. It's not particular for child-sensitive social protection, but it is for making social protection more effective in general, which will also benefit children, which is about strengthening the functioning and implementation of existing programs. These challenges that we saw are an issue in general, and addressing these will make a real difference for children. Expanding of coverage, making sure that more children are reached. And here we really suggest a twin-track approach. One is making sure that government extends its coverage, extends its target groups. And the other one is by raising community funds. And here Save the Children has been quite active, using child endowment funds, for example, and we'll hear about that. Now, of course, government will always say, well, we don't have money, there's a budget constraint. But in a way, it's about priority. We haven't talked about civil servants' pensions or benefits at all, but in other work that was done at IDS 2 years ago, when you look at the vision of budgets across social security at large, what goes to social protection in terms of these kinds of transfers versus what goes to social security for civil servants, it's very skewed. The bulk of the budget goes to their end. So it is really about how that money is divided as well. And the issue of prioritization also holds when we talk about transfer amounts. Again, that's a budget issue. But the old age allowance has been increased from 500 to 1,000 rupees in the last financial year. So for that kind of transfer, there is scope. So again, an issue of prioritization. Making program registration more responsive and flexible. This is an ongoing process at the moment. And somehow strengthening the sensitization and awareness raising as part of the programs. Now, this could be done through NGOs, such as Save the Children and the implementation partners, but it could also be done through government structures. All the payments are being done physically. So every 4 months, people come to one point to collect their transfers. And there might be scope to get health extension workers or agricultural extension workers, education advisors together and use that opportunity for sensitization. Improving the link to child protection by building those referral mechanisms and linking into the child protection sector. Establishing grievance mechanisms, but also at the same time raising people's awareness and voice so that even if those mechanisms are in place, they are able to use them and feel empowered enough to use them. So just putting the mechanisms in place is not enough. And finally, this is more at national level, creating more clarity about the purpose of social protection and also about the concept of child-sensitive social protection. So one of the issues that came up a lot when we did interviews at national level is that people said, well, generally people are unclear about what social protection tries to do, that it's just a handout, it creates dependency. And they're even more lost when we talk about child-sensitive social protection for children. So more generally, creating clarity or having a debate about what it means would be an important step towards improving child sensitivity for social protection for children in Nepal. Okay, thank you. I'll leave it at that for now and hand over to Disa for examples from your programming in South Asia.
Inviting me to come here. It's a great pleasure to be here. I must say I have completed my PhD at University of Estonia in 1999 and I haven't been at a university since then. So it's a good opportunity to come here and talk about something that I've been working on for the last 6 years together with some colleagues of mine at Save the Children. So the topic is then child-sensitive social protection and what approaches we have developed in South Asia. So let me get into the presentation. So the contents of this is really that I'll say something in brief about this initiative, and I'll say a little bit about how we understand CSSP. I'll call it CSSP now because child-sensitive social protection is very long, so it's easier to just say CSSP. And my focus will be on different approaches that we have used in South Asia in particular, and I'll say something about what we have achieved and a little bit about the challenges of this program. So this program has 3 building blocks. The first one is about improving access to government social protection, because like you heard from Keetie also, she has mentioned that many people are not aware about the programs, the eligibility criteria, they don't know what the transfer amounts are, etc. This is a big problem. And there are in South Asia at least lots of government social protection programs available. Even they may not be a perfect fit and they may not always be responding to child poverty or other forms of poverty, but they are there. And so we feel that we should be working towards improving the access to these programs. That should be a starting point. Having done that, then we can work on the child sensitivity, which is then the core of our business really, to make sure that parents, caregivers invest social protection that they access to in children. And they also, we need to look at the communities where caregivers are placed, so they also need to become sensitive towards children's needs and rights. And then depending on the program we work with, we also need to work with selected service providers. It could be child protection systems, it could be schools, depending on the program. And then the third part of this program is to work with the government to improve child-sensitive social protection programming as well as policies. So when we get studies such as the one Keetie has done for us, we can use that to advocate at national level. And I put 2 things here in pink below, because we are increasingly now saying that when we work with social protection, like you also heard many examples from Keetie's presentation, we really need to also work with the service delivery. Many times schools are not providing all that much quality in terms of the education, or child protection systems may not be functional. So if you look at the global whole debate about social protection, there is a big understanding now saying that if we don't improve services, social protection will have a limited impact. So in our programming, we are increasingly also focusing on this particular part. And in a few cases, we do pilot new programs as well. We try to avoid this because it's better to directly influence what the government is doing, but we do kind of work at that as well. So this is the location of the program. We have 2 projects in India, if you know India. So there's a state of Rajasthan and there's Bihar. And then we have a project in Nepal, we have one in Bangladesh. And we have recently started in the Philippines, so that's not South Asia anymore. But it's following the same model as we have used in South Asia. And we have been working on this since 2011. So almost 6 years, and the budget is not huge for this program. It's 1.1 million euros, but that's because we are not actually giving out any cash transfers or any social assistance. It's all about accessing what the government has. So I think Keetie has talked about what social protection is more or less, but let me just say for this particular program that we see social protection as social assistance, so cash and child transfers, so any child benefits, child grants, midday meals in schools, pensions, etc. That's the biggest focus of this, because that's what the government normally does when it develops social protection. The large focus is on social assistance. And we also work with insurance. Even the government has certain social insurances, especially health insurance. And in this particular initiative, we have also worked on something we call targeted and time-bound social services, which is not always in the global debate considered to be a social protection program. But if we look at it with a concrete example, let's say a child is out of labor and has to get back to school. So it's very difficult to come back after 2-3 years to school. So we have set up a non-formal educational centers for child laborers where they do a bridged course. So in 1 year they might cover 3 years, and then they can go back to mainstream school where they can also access a education stipend. So, like Keetie already said, social protection here is about, the way we define it is that it should result in positive development outcomes for poor and vulnerable children. And we focus on programs that are targeted specifically at children as well as the ones that are targeted at the household. Globally, we have a position paper in Save the Children that talks also about how CSSP should be done in a humanitarian or an emergency context. So it's a little bit broader than this. I'm talking more about this specific initiative here. So it could just be good to say now why we need to have, why child-sensitive social protection is needed. The basic starting point for us in Save the Children is that it is a human right. So children have a right to social protection just like adults. And it's important that we as adults, we are responsible for children, so we need to make sure that children get social protection because they are not in a position to claim their rights and they are dependent on adults. And children are really vulnerable to malnutrition, to not being in school, etc. If we don't intervene at an early stage, then there will be long-lasting effects and the children will grow up as poor adults. So intervening in childhood, in the early parts of the life cycle, is a good way of investing. So that's another argument for the child sensitivity. And finally, also, Keetie has brought up an example from Nepal that a social protection can have an adverse impact on children. And I'll be bringing up another example from India if we don't look at child sensitivity when we design and implement the programs. So what are we trying to do? What is our aim in this initiative? We want to reduce child labor. We are trying to increase regularity in school, so children come to school, but that's one part. They should also attend school more. We look at overall improvement in well-being for orphans, because there are a few cash transfer for orphans, and also to reduce malnutrition and improve growth monitoring. And finally, sustained access to government social protection. Yeah, I just wanted to say something about when we started this program and when we still start social protection programs. It's really good first to understand child poverty and vulnerability because it makes it easier to design, especially the child sensitivity part of the program. So if we are looking at, let's say our interest is to work with social protection around child labor, now there may not be any specific programs for that, but there might be several programs that we can use to address child labor. So it's important then to map how many children are in labor, in different forms of labor. They might be in school, they might be totally out of school, whatever other situations. It's good to know those and to try to understand the magnitude of that. And then we don't only look at how many children are in labor, we also look at how vulnerable children are to getting into labor, and that means understanding more about the situation of adults. So often we know that households where there are single parents or where there is an adult that's chronically ill or disabled, when children live in such households, they are more likely to come into child labor or to be malnourished or not to be taken care of. So we try to map this situation. We call it child poverty and vulnerability mapping. And then we look at secondary data as well, if we can understand some trends. And another really important part for us is knowledge, attitude, and practice analysis. So if there is child labor, we say that social protection can address that. But we want to build child sensitivity in the program, so we really need to know as to why is child labor there from the household. Is it just an economic reason, or are there other reasons? Like there could be a trend in the community. In many communities, parents just send the children to labor because others are doing so, or it could be that they feel they are best placed in labor rather than school. There can be lots of reasons. So if we understand the reasons, then we know how to package child sensitivity. And then of course we look at services. Sometimes the school may not be good, so it might defer parents from, or even children, to want to go to labor instead of going to school. So we need to understand the whole situation in order to design child-sensitive social protection. And then I think this whole thing is about analyzing social protection programs, and that's very much what Keetie has already explained. So trying to understand objectives, conditions, targets, what's the impact on children. So we go through all the programs that we want to work with from that sort of lens. So the first thing, like I said, we do is to improve access to government social protection. So this is a lot about information to start with. When we started up in 2011, we realized that people didn't have a clue about the eligibility criteria, how much money they were supposed to get, who was supposed to get it. So we had a lot of massive information dissemination and campaigns about existing schemes that the government has. And then our staff in the field also got into supporting people in the whole application process, because there isn't anybody there to help. So we did actually help people to fill in forms. And many times we had camps in the villages, so we called the government as well as people could come during a specific day. So there and then the forms could be filled up. And often there's a problem with the documents. People don't have documents that they need. So in Nepal we have gotten into something which is called vital event registration. So at the village development council, at the local government level, there's a computerized system now. So when somebody gets married, there's a death, it gets registered automatically. And when people need such a document, they can go there and get it straight from the computer. So this will then help them in accessing schemes as well as other facilities of the government. Another approach that we have used to access is community-based targeting, and that has been quite successful in Bangladesh, where now this is because there are about 50 people who will get a certain scheme, but if you look at the eligibility criteria, 5,000 might be actually eligible. So how do they choose? It's based on nepotism or corruption, or nobody knows. It's up to the elected government. So we introduced community-based targeting, in which we got respected villagers to do a mapping of the community and then targeting with including everybody there and trying to select out who should really get and who is most needy. And I wouldn't say it's perfect, but it's much better, and it has become much more pro-poor than the way the government does it. Another way of improving access to social protection is to do monitoring by the community. In the state of Bihar in India, there is a program under the Integrated Child Development Services where food packages are distributed to preschool children. Now, this isn't happening very well. There is very little distribution, but the community has started monitoring this. So after that, the rate of distribution has gone up hugely. So this is another way. And increasingly we are trying to move into more formal ways of making sure that people access social protection. So looking at really formal accountability measures and mechanisms. In India especially, there are many acts that can be used. The Right to Information Act, Public Services Guarantee Act, and Public Hearing Act. So it means that if you have applied to a social protection scheme but you haven't got it, you can then put in an appeal or a complaint, and there are a certain number of days to which the government has to respond. So that is actually happening now when people are aware of this, and of course we are supporting the process to start with. But as this increases and people are doing it more and more, they will be able to do it on their own as well. And in Nepal, the government is supposed to have public hearings and social audits at the village level, but that wasn't really happening. But Save the Children is actually helping government to do that. So you can see here on this photo that all list of all beneficiaries for particular schemes have been mentioned, and this is during one of the public hearings. This is the core of our work, how to make social protection more child-sensitive. So I'll take a few examples. This is a little bit similar to what Keetie was talking about on public works. This is probably the largest social protection program in the world, the Mahatma Gandhi National Rural Employment Guarantee Scheme, which gives anybody who is above 18 the right to 100 days of work in a year. In this particular area where we are working in Rajasthan, it's working quite well. People are getting access, and they're getting, if not 100 days, but 80. What's happening here is that men are migrating and women are left behind, just like in Nepal, so it's mostly women working. What we found were that children were dropping out of school because there's nobody there to attend to the children at home. So the older siblings are put into childcare, or sometimes they are substituting at the work site. And sometimes we have also seen that young children were totally left alone to fend for themselves, 2-3-year-olds. So it's a big sort of issue in terms of child sensitivity. So what we have done, we have developed crash facilities together with the government, and we have also facilitated the communities to develop their own norms against child labor and for school attendance. And this is again with the lowest level of local government called the panchayat in India. And now these sorts of approaches are, the government is getting interested, so we are also negotiating for scale up. And here we are trying to introduce a maternity benefit as well, so that pregnant women or women with small children do not need to work. And that's already actually happening in a few states in India. Palanha Yojana, this is a cash transfer program for orphans. It's 1,000 rupees a month, it's in India. So it's a sizable amount. What's happening is that there are many children without parents in this particular part of India because they often fall ill, sick and die. The fathers, when they are working out, going for labor work to the neighboring state. And mothers are left behind, or sometimes mothers also abandon the children. So many of the children, they live with their extended kin. So when we started analyzing the situation, we found that most of the children were really living in a very dire kind of a situation, physically, emotionally, and socially. So, and the cash was coming into the family, but there was nothing more than the cash. So they were not really knowing in certain cases how to take care of the children, and in other cases, probably not even interested. And the condition is that the child has to go to school, but that was hardly monitored by the government as well. So we then developed something we call a cash plus approach, or the Palanha plus approach. So we're now working with caregivers to develop their skills so that they can take better care of the children, and we're working with children as well to develop their life skills. And we're also trying to see how, what impact are we having through this intervention. So we have done a baseline study of 130 children that we are now going to follow up once they have gone through this program. And again, the government is interested to work on this program at scale with us. This is an example from Bangladesh. In Bangladesh, there are not so many child-focused programs, but there are a number of programs focused on the household, and the amounts are pretty small, but it's again the whole idea, if you can try to make the household invest small amount in children, that you can have, there can be a certain impact, and we have seen that there are certain ways of working when the cash is being given, like asking the head of the local government to have a discussion with the household that, okay, you're getting this money, we have selected you, now make sure that you have your child in school. That can be quite effective. And then we have developed community watch groups in the community. So they are sort of informal groups of respected elders or respected villagers who try to make sure that children are not in labor. So they go and follow up with the households and create pressure. Child marriage is a big thing here, but you can now again use social protection to say that the child should be in school and not be in labor. And here again we have parenting sessions. That's a very effective way of working with child sensitivity. Children are very much involved in Bangladesh in having theatre groups to talk about social protection, and that actually there's no need to send children to labor because we're getting money through these stipends or whatever program is coming through. I have mentioned here the employment generation program or the Bangladesh group development. So this is sort of another way of working. And in the Philippines, I think just a couple of, do I have time, Keetie? Going a bit fast now. In the Philippines, there is a big national conditional cash transfer program, which is modeled on the famous South and Latin American programs. It's for children from 0 to 18 years, and there are a number of conditions that have to be fulfilled in order to get this, and there the government really monitors the conditions. So we aren't really very much in favor of conditions in Save the Children, because we feel that it's not like the parents are really internalizing that they need to have children take them to vaccination, or they need to be in school. that's not really happening, that they feel it, but they just do it because they feel that this is a condition, we won't get the money. But we can't take away that really easily, and we don't really need to, but we can work on certain ways of making this program more child sensitive. And one big opportunity is family development sessions. In the Philippines, there is a condition that you need to go to family development session once a month to get a certain amount of money from this cash grant. So we are now trying to work around how do we make these sessions more effective. At the moment it's more like somebody comes from the government and gives a lecture, but it doesn't seem to be having so much impact. So we're trying to see how we can make it more effective, drawing on experiences from India and Nepal and other places where we have been working a bit longer. Just briefly about new social protection programs. Like I said in the beginning, we don't really want to get into piloting a lot of new programs because we try to work on what the government has. But in Nepal, we found when we did our child poverty and vulnerability mapping that there were a large number of orphans there. Parents have migrated or abandoned children, and there's nothing for them really. There's no social protection program. So we started something called the Child Endowment Fund, which is a capital fund created at the local government level with the Village Development Committee. So some money is used by the Village Development Committee. They get money from the government, and they are supposed to use a certain percentage for children. So they use it for this capital fund, and Save the Children gives a matching contribution. So this way we are able to give cash grants to orphan children, and then who gets the grant, that is decided by the Village Child Protection Committee, and there are guidelines written up as to how the selection should happen. And they also monitor the child and the child's well-being, so there's a follow-up with the household. Here also, whoever gets the grant, the children as well as the parents or the caregivers, they will undergo a program of child sensitivity, again to try to make sure the grant gets invested in the child. And this we are still feeling that we need to improve it a little bit, so we are working between India and some of our other programs to draw on different lessons learned. And here the government is really interested now in Nepal. I just heard last week to scale up this program. So that's very encouraging. Here is an example of a girl who is getting the Child Endowment Fund. She lost her father, her mother is in labor, in wage labor, and she is not keeping well, so obviously there's a big economic burden on the household. So this girl is the oldest one. I have blurred the picture a bit because we normally don't show the identity of some children that we work with. So she had to be taken out of school to go to labor against her will, of course. But now the mother has participated in many sessions of Save the Children, and she has been convinced to bring her back, and she's now getting the Child Endowment Fund. And through some of the other work of Save the Children, she's also getting the scheme for single women. So there is some cash coming in, and now the child can be back in school. Another piloting that we have done is a community health protection program. What we found in India, in Rajasthan, when we started the work and we did the child poverty and vulnerability mapping, is that when there is a health shock in the family, normally what happens immediately is that children are taken out of school and they become a coping strategy because there is no money to pay for all the health care that has to come in when there's an accident, or even if there's a death and there's nobody to work. So children become a coping strategy. So we started this community-based health insurance program, which is based on a platform of self-help groups. So there was already a platform in terms of lending and having to deal with money, etc. So it was good to set it up on something where there was a base. And it's not just an insurance part that comes into this, but we also have a community health service. Like I said earlier, normally services are needed to be included in social protection. It will then work better. And we have linked up with certain hospitals as well to provide care when the beneficiaries of this scheme have to be taken to the hospital and be hospitalized. 16,000 people have been enrolled in this program, and it's moving towards self-sustainability now, I would say. So maybe another year or two. Finally, integration with service delivery. In Nepal, we have been quite successful in bringing many children back to school because of access to social protection and child sensitivity. Still, when they're in the school, it's important that they learn, so we have introduced quality learning environment in the school as then this integration between social protection and service delivery. So this is going to have a better impact, we feel, because bringing children to school is fine, that's the starting point, but social protection will not do more than that. We need to work on the services as well, so integration will give a better result. So I would say finally then we have probably supported more than 100,000 people to get access to regular social protection. More than 3,000 children have come out of labor and they are back in school. And some 1,000 orphans are involved in our Cash Plus interventions in Nepal and in India. These are some of the key achievements in terms of numbers. But to me, the numbers is just one way of showing what we have achieved, but the more important is probably what we can do in terms of improving systems in the long run. And now in Nepal as well as in India, the government is interested in the approaches we have developed. So there's a lot of appetite for scaling up and replicating by the government itself. So there are various discussions going on. In Bangladesh, we have managed to change the targeting of one of the programs. So that's an achievement towards more sustained systems changed, if you wish. There are a few challenges. In any development program, there will be so many challenges in terms of working with the government, but I think one key challenge we have here, if I'm looking at it from a Save the Children point of view, is that high quality monitoring and evaluation isn't really our key area of expertise. So we're sometimes having a problem to come up with evidence, and it's quite expensive to also have really good studies done. When we scale up with the government, then government doesn't have the expertise or the staff sometimes to work on child sensitivity, accountability, or transparency. So it becomes a bit of a challenge to scale up our models. Thirdly, I would say it takes a lot of time. CSSP is something quite new, not like education or health that has been worked on for so many years, but it takes a lot of time to develop approaches and models here. That's it. I think I'm trying to be a bit fast. I think it was still too long. Yeah, so thank you so much. I think that's it really. I mentioned a few of my colleagues from Save the Children who has been part of developing this program over the last 6 years. Thank you.
Thank you. Okay, I'm just going to put the slide back up for those who are following us from far away, so they know where to direct their questions. And in the meantime, Verdiana has a microphone for any questions in here, so that people who are following the live stream can also hear them. Are there any questions?
Thank you very much to both of you. Really enjoyed that. I just had a question. I really like the mention of monitoring evaluation at the end. And I wondered if you had a view as to what the characteristics of effective monitoring and evaluation with CSSP interventions.
Are there any more questions? Yeah? Okay.
Thank you very much. I must say it's hugely impressive, the range of activities that you have, the initiatives that you take. I wondered about children themselves and whether, and if so, to what extent and how, and with what success and results you consult children about their priorities.
Thank you. I was wondering, you mentioned these parenting sessions or good family promotions, and I was wondering how exactly they look like. Do they involve men as well, or are they mostly targeted at mothers. So if you could elaborate on that a little bit. Thank you.
Great. Disa, they're all for you. Thank you. We need to talk into the microphone.
Probably yeah, best.
Let me then start characteristics of M&E, and probably that is something what we need help with to develop. It's not that we don't have M&E, we do have M&E, so we count numbers, but I think more systematic, even rigorously organized qualitative monitoring can also be done. We often just put together numbers of how many we have reached, or we don't have we have systems in place, but we don't get real impact out of that. And if we are thinking that we want to look at something like impact on parenting and say cash plus models, then it's really hard, because we cannot go and do some studies ourselves, but it's not the same as having somebody having and do a rigorous, even if it's partly qualitative. And if you're thinking about controls and that sort of thing, then that's again very, very expensive. So I think it's on several fronts, and I think now as we are designing new programs at this point of time, we need to think about this more at the outset. I think the next one is on children's participation. Yes, I realized I was feeling that this was getting very long, and I had not included it in my slides as well, but children's participation, of course, wherever Save the Children work is really, really important. In all our programs we have, in the CSSP programs as well, we do work with meaningful child participation. So we have children's platforms, forums, interactions with the local government, with service providers. We facilitate that. We have children involved in the CAP assessment, the knowledge attitude practices. So it's really, it's different in different places. In Nepal we work a lot with child clubs, as well as in Bangladesh. In India it's more informal, and in Philippines we are going to try to make children's voice come into the grievance redress mechanism system, so that children can raise views about the conditional cash transfer program. It's very important. It's difficult to know in such a presentation what to select and not, but yeah, I'm glad you mentioned that. Parenting sessions. In parenting sessions, the idea is that mothers and fathers should both be there. I think increasingly we are trying to work with fathers as well, but there is a challenge here because often men migrate, so they are not so regular, and even some of the mothers are not able to come regularly every time. But I'm glad you pointed it out, because the whole gender perspective is really important here.
Any further questions? Yes.
Yeah, I just wanted to know if you could go into any detail about what's actually included in the family training sessions.
I would also like to know a little bit more of why the position of Save the Children is of not having a conditionality. I mean, you said Roelen.
I think the parenting sessions, it varies a little bit from place to place, but one sort of key trend in this is that since parents are now receiving social protection, mostly cash, we talk about the amounts that, even though they are small, but how they can make a difference for children, so and how they can avoid sending them to labor, how they can have better nutrition. So it can include sessions on how from locally available food sources you can have better nutrition, how you can, it talks about child labor in most cases and the ill effects of child labor. There are sessions on health and hygiene. There are sessions about caregiver and or parent-child relationships, because that's often quite poor in some of the areas where we work. So how to improve communication with the children, and I think those are gender is another one. But we touch upon all these things briefly. It needs a bit more. The challenge is that then you are taking more of people's time, so how much can you take? But I think these are the sort of things that come through child protection, how you should not hit your child, different forms of abuse. I think these are the sorts of sessions. Condition, I think I should ask Keetie to reply to this, because she has written a very good article on the ill effects of conditions.
Okay, well, of course, I cannot comment on why I say the children's position would be against conditionalities. Well, I think there's two sides, two approaches to this answer. I think one is from the evidence and the other is more ideological, maybe. So conditional cash transfer programs are very popular in Latin America, and they have good results. But when we look at the few studies that have been done that compare the impact of conditional versus unconditional transfers, we don't really have firm evidence that imposing conditions has much more positive impact than just giving parents the money and having them decide what they do with it. So there's positive impact, but nothing to suggest that you need the conditions. And so without that evidence, I guess it's a question, do you believe that people are able to make good decisions for themselves and for their children without being nudged or even forced into a particular direction? I think we do have evidence from different programs, conditional cash transfer programs, where there have been these adverse consequences with particularly really high burdens on women having to meet these various requirements, struggling to make those, meeting those requirements, and that also reinforcing some of the gender inequalities, for example. There are some examples of where children have to be below a certain weight to be able to qualify for a transfer, and so they get fed less the week before they're being weighed. Or children have to attend all days in school, and so they also have to go to school when they're sick. So, and some would say that's anecdotal evidence, but it happens. More fundamentally, though, I think a punitive approach isn't necessarily something that you want to advocate for. I think the kinds of initiatives in the CSSP program that say the children run, such as the parenting and the family session, but from a more positive and encouraging perspective, might do just as well in terms of the impact on children, but all together in a much more positive way. So, I mean, my view in terms of providing social protection without conditions is fully in line with the Save the Children's view. I don't know exactly what the reasons for Save the Children are.
The same as yours. So our Guruji in my case on CSSP. It's the same.
Okay. Are there any last questions? No? All right. There's no questions through Twitter, but I would like to thank you very much for everyone's attendance and participation. Just like to say that the report on Nepal is due to come out, I think, in the next month. It's probably a fair estimate. There have been quite a few publications on the Save the Children CSSP program, and Disa brought some documents along, which are on the table there, that you can take if you like. And there's also some other work that we did at IDS with another organization called Family for Every Child on social protection for children. And on that note, thank you very much, Disa, for coming out, and thank you all for coming.